Hi guys, I'm Peng Ru. I'm back today again to talk to you about 10 possible failures with your dental crowns. It could be with the dental crowns themselves or the tissues around your crowns. I will be categorizing these failures into 4 main ones: aesthetic, biologic, structural, as well as procedural. So the first category I'll be talking about is aesthetics, and the first thing would be shape, which is really important for your front teeth because they show when you're speaking, when you're smiling, in day-to-day life, it's really obvious. So we don't want to have something fixed onto your tooth that sticks out a lot. So the important takeaway here is to check your dental crown under different lighting conditions before they are permanently cemented or bonded in place. We could try to adjust the color by staining it, or if it's really a poor fit in terms of shade, then we have to just make a new one. Okay, so the next thing about aesthetics is gum recession. So this is not really a problem pertaining to your dental crown. It's just that sometimes after a number of years, gums around your crown can recede. If it's gum disease, obviously you have to get your gum disease treated. If it's just because of traumatic toothbrushing and you wish to kind of bulk up or rebuild the lost gum tissues, then a gum surgery may be an option for you. Okay, so moving on to the next category, which is biologic failure of your crowns. So a really common one is decay under your crown. Well, a common misconception is that, hey, my crown is wrapping my tooth all around, it's covering it entirely, I'm supposed to be immune to decay, right? Because when your crown is fitted onto your tooth, there's still an interface between the crown and your tooth. And we try to fabricate it really accurately so the crown fits really well and this interface is really well sealed. But sometimes decay can still sneak under this crown and cause problems. So I think you want to try to prevent this problem entirely by practicing good oral hygiene. Seeing a dentist regularly is important as well, so we can clean professionally around the crown. The next biologic problem that I will be talking about is metal allergies, which I feel is a pretty rare thing, but obviously it's a thing, so it can still happen. So what you may experience with a metal allergy is redness, discomfort, irritation of the soft tissues around the metal crown once it's fitted on. If that's the case, then you want to try to use a ceramic material for your crown instead. Alright, so the next category of failures I'll be moving on to will be structural. And the first thing that comes to mind will be fractures or chipping of your crowns. Well, the materials that we use to make the crowns nowadays, they are really strong and tough, but your oral environment is really harsh as well because we are using our teeth to bite and chew on so many different kinds of foods that have different kinds of hardness. And some of us, we're really stressed and we grind our teeth at night. So these crowns are just subjected to a lot of stress, okay? And they can show signs of failure at some point. They're not going to last forever. We want to try to prevent this problem, right? So I would just say, in general, it might be good to avoid really hard foods, things like ice cubes or using your teeth to open beer bottles or bite on crab shells. You want to try to avoid that as much as you can. And if you grind your teeth at night, it might be advisable for you to wear some form of appliance like a mouthguard to protect your teeth and your crowns. And the next structural failure is kind of related, so it's wear and tear. So your crowns may not fracture or chip, they can just kind of grind down over time because you use them extensively. Sometimes when your crown is really worn, then the thickness of it kind of reduces a lot, and sometimes it can get to a point where the underlying tooth becomes exposed. So to ensure that this crown is still serving you really well, if your crown is really worn, I would strongly advise you to replace it. Alright, so the last form of structural failure I'll be touching on is a loose crown. Well, it's kind of a structural failure, it may not necessarily be the case, but well, it can happen for a variety of reasons. You may have knocked on your crown, or it could just be that the cement of the crown has kind of worn out over time, or even maybe the tooth that's supporting the crown is really short and there isn't really much retention going on. So if your crown becomes loose, you should see a dentist immediately who will identify the root cause of the problem. Alright, so I'll be moving on to the final category of failures, which will be procedure related. And the first one that's pretty common would be sensitivity. This sensitivity can come from three main causes. The first one will be bite related. So after the crown is fitted on, you could feel maybe the bite is a bit uneven, you're biting a little bit higher on the crown than everywhere else. The second one would be that the crown is not fitting on really well, and so there's a particular area that is not well sealed. The third one would be due to the fact that we had to trim your teeth quite a little bit to fit on the crown. Obviously, we try to be as conservative as possible, but some trimming still has to be done to create space to fit on the crown. The first course of action will be to just treat it conservatively. So your dentist may advise you to try to switch to a toothpaste for sensitive teeth, for example Sensodyne or Colgate Sensitive Pro Relief. So you can use that toothpaste to brush your teeth, or even just apply it topically around the crown and leave it on and go to bed, so that this desensitizing action can work a little bit better. As usual, the main takeaway is to maintain good oral hygiene, have good dietary habits, see your dentist regularly so we can pick up any problems earlier. And yeah, if you have any questions or issues with your crowns, or maybe you think you need a crown, just feel free to drop by and be happy to talk to you a little bit more about crowns. Bye!